Well, I've been a chiropractor for about 20 years now. I'm coming into my 20th year, so I'm pretty excited about it. And I became a chiropractor because I had a really great experience the first time I went to the chiropractor. It was in a ski accident and I couldn't turn my neck. And I went to the doctor and he said, just take some pills and you'll be fine. Well, 3 or 4 days later, I still wasn't fine. And I went back and he said, well, there's nothing really wrong. There's nothing I can do for you.
I started seeing Dr. O'Neill around late 90s, 95 to 97 in there. I've been working in industry for the last, well, 30 years now, but it was heavy duty stuff, paper making. There's a lot of lifting and pushing. And I just started having aches and pains, so I just started coming here. My brother had come here and I'd heard references, so I tried it and I found that he was able to keep me quite mobile and active.
Well, a friend of mine said, go see my chiropractor. I said, well, what does a chiropractor do? And they said, you'll see. And I went there, and without me telling him what was going on, he told me where it hurt, he showed me how he could help me, and after the very first visit, I was already feeling better. So for me, it was an amazing experience.
I was run over with a forklift at work and did a lot of knee damage and hip and shoulder and the whole bit, and he was able to keep me walking fairly straight and kept me going through the surgery and helped me on rehabilitation through it.
Well, what makes us so unique here is that, again, we have a very functional-based approach. So we invite patients to experience something really unique and different. So the first thing we do is we get people moving, we get their joints aligned, and that's so important. The second thing is in tone, improving their tone. So whether it's showing them how to do some stretches or encouraging to see the massage therapist if that's what they need, that's what we get them involved with. And then finally, strength, because we know that the stronger they are, the more they have to help them with the tools that are necessary, the better off they're going to be. And that's what makes our approach so unique. Function, alignment, tone, and strength. Well, on the first visit here, we invite patients in, and the first thing we do is we ask them a history. Find out where they are, what activities they do. Secondarily, what we do is we look and see, is there anything missing in their lifestyle? Are they taking vitamins? Are they looking after themselves? Are they sleeping properly? Do they have proper workspace environment? And we take all that into consideration. Then we do a physical exam. We take a range of motion test, and that we use to assess before and after. One of the other things that we like to do is find out, is the problem they're having from the spine out? Is it from the nerves exiting their spine? Is it from the ground up? So we also examine how their legs are functioning, how their feet are functioning. And on subsequent visits, we'll do a gait analysis. We'll assess to see, is this something that they need help with as well? This is how the Impulse IQ works. It's a very rapid, high velocity thrust that's faster than my hands could be. So it allows me another tool that helps me deliver the best treatment that I can for my patient. Well, on the second visit, the patient comes back and we review all the things we discovered in the first visit, what their needs are, how we can best help them, and we just tailor the treatment to their needs, exactly how it would benefit them the most. One of the most amazing experiences I had in chiropractic was really first few years of my practice. It was great and I had a really great time and we helped a lot of patients, but one day this fellow came in and I was asking him about his problem, and he told me about he had neck pain that had been in his neck for a long period of time, for years and years and years, and he had constant headaches. But he really didn't talk about his history or anything. And after I treated him the very first time, he stood up and he said, wow. And I said, what? He said, that is the first time I have not had neck pain since I was in the coma. And I said, coma? You never told me about a coma. He said, yes, when I was a young child, I was hit by a bus and I flew 70 feet in the air. And he said he landed against a curb and he was unconscious and in the hospital. And oh, you'll have to excuse me, it was so moving. And then what happened is, he said he had been to doctors and he'd had several visits and they could never help him. And after that moment, after the first treatment, he woke up, or he stood up and there was no neck pain. He said, my headache is gone. I can't believe this. This has been absolutely unbelievable.